Hello, this is Dr. Pola Rosen, publisher of Education Update, and it's my great pleasure to be here today in the center of the city with the most magnificent view with none other than Dr. Guido Sarnachiaro. Is it all right if I call you Dr. Guido?
That's okay, no problem.
Because the other one is very long.
It's long.
So Dr. Guido is a dentist who does all kinds of treatments, but I think particularly you specialize in implants, dental implants, is that correct?
Dental implants and the reconstructive portion, basically the surgical aspect and the prosthetic aspect, which is the crowns that go on top of the implants.
Right. So tell us a little bit about your background, how you prepared for this career, and that will give us a guide for other people who want to enter dentistry. What do they have to do to work with a view like this, with orchids, and look at these wonderful awards that you've got from the Mexican Periodontic Association. Anyway, what did you do? What was the road map you had?
Well, this started actually, I come from Argentina, so that was the background of my education back home in Argentina, and I went to dental school there. I got my dental degree, my regular degree, and then I went into specialty training. First of all, my dad was the dean of the dental school back home, so it's a family of dentists, it's a tradition. My sister is a dentist too. And so after I finished my regular dental degree, I had a talk with my father and I said, well, what would you like to do now? Because there's always further education. I went into the prosthetics training, which is basically all the crown and bridges that are done on regular teeth. And then after that, I got even more motivated, so I went into the surgical phase, which is doing all the foundation for the implants, and got into specialty training for surgery, and then ended up doing a fellowship in implant dentistry. And
this was all in Argentina?
This was all in Argentina,
okay.
Until a point that I started lecturing, at the very young portions of the dental meetings, and I get to also meet one of my father's colleagues, which is one of the founders of this practice, and he saw me presenting, and we were discussing at dinner back home in Argentina, because we had him as a guest lecturer for a meeting in our school. If I would consider a career abroad, and in all fairness, I was doing great, and I had my office, and it was like a family practice because I was practicing with my dad and my sister, but that really started a new phase in my life because I found that it was very challenging, and I think at a great moment in my life to be able to try something like that. I was not married, so it was just a matter of like a very personal project that I could take on.
Right, you were in your 20s, I'm assuming.
Yeah, late 20s.
Okay.
And so I said, why not? Inside me, I knew that it was not going to be just why not. I knew that I was going to do it, and if I started, I was going to finish. Mm-hmm. And so I came to the United States, finding out all that I had to do beforehand, and I had to prepare for exams like boards before you come in order to be eligible to get into the dental school.
So did you have to go to dental school all over again?
So basically there is a program that they get you into the dental school, but like it's called advanced standing, because instead of getting you in the first year of the dental school, they match you and they get into you have to take those. That's why you have to take those boards, and then they get into the second year of the dental school, and you have to, even though you're a specialist in your fields, you have to go to basically undergrad, which is going back to dental school. And those were 3 tough, long years of going back to the basics.
And they were expensive, weren't they? For the average person to
still
start paying tuition. Oh, okay.
Yes, of course, because education has gotten really very expensive at the highest level. I had the lack of being able to study at NYU, College of Dentistry.
But they gave you some credit for your previous work in Argentina.
Yes, so basically we're talking about a year less that you have to go through.
All right.
And at the same time, I was working, I was studying, and then also working part-time at the implant department already while I was doing my undergrad with Dr. Tarno. So Basically, my days were like from 8 to 8. It was an all day at NYU. But it was, in all fairness, I look back and I would do it again. It was very tough 3 years.
But that was a very courageous thing to do because you left your entire family and your friends.
Well, I have to agree with that.
Start on a new path.
And I have discussed, it's a very good point that you make, because I have discussed this, and there's a few things that are very difficult decisions in life. One is leaving your family, your friends, and also your country. And these are the three combined. So basically, you're leaving to start a new life in a new place, new culture, and all that put together. There were very difficult moments, I have to say, emotional, that you just question if it's the right decision. But I think that there's something inside us that still guides us, and there's the strength that keeps you going, and that's why I thought that this was the right thing for me.
Well, if you had a choice right now to have your old career back and be very successful in Argentina, or let me rephrase that. What would you like to do in 20 years? Do you want to go back to Argentina, or do you want to stay here?
Probably retiring in Argentina.
Yeah.
But at this point, I think that I have been able to develop a very nice and challenging and thriving career, and I'm giving back to where I'm at right now. I go back home every time I can, and I still practice. Whenever we have a running practice that my sister and my family runs, and I always get to see old patients.
It's wonderful.
So
you really made a bridge between the two countries.
And I did. And,
you are a dentist in two worlds and two separate hemispheres.
Yes, and there's also some interdisciplinary activities between practices because, for example, here we do research, and so we share knowledge, and we exchange data and information when we do multi-center studies. So this really something that I think it has worked very, very well.
Are you doing some teaching now as well?
Yes. For the last 2 years, even though I finished and I graduated at NYU, and I was teaching at NYU after I graduated, then 2 years ago I moved all my teaching activities up to Columbia University, and I'm there on the faculty as a part-time, so I go there once a week, and I love teaching, I love the students, I love the feedback. But obviously, I cannot dedicate more than a day a week, provided that I'm still, growing my career, my private practice. So.
Right. What is your advice to young people today who are thinking about the dental profession as a career? Is it a good one to go into?
Yes, don't get discouraged because of the tuitions. It's a very big, it's a huge burden that students start with. That they're not getting any cheaper, and unfortunately we're all struggling with this problem with the student loans, which unfortunately they're not that student friendly, in all fairness, with rates that are...
But is it a good career?
But I think that I would still, it's very difficult to advise somebody to just go into a career, but I think that if you love this career, don't get discouraged because of the burden of finances and tuitions, because at the end of the road it will just pay off.
Is it cheaper to go to dental school in Argentina?
100%.
Really?
When I went to school in Argentina, all my undergrad to become a dentist, I paid zero because it's a public university, so it's government funded.
Wow.
University of Buenos Aires.
Wow, that's very interesting.
Then for specialty training, you normally pay, and unless you do hospital training, which in oral surgery, which I did in the hospital in the province of Buenos Aires, and that's also public, so you don't pay. It's like social.
What technique do you do the most of? What's the most popular thing that people come in and want to have done?
Well, we're kind of like, if I had to define this practice, it's kind of like the end of the road in terms of complexity. Over 60% of the cases that we do in this office are redos of other work that was done before, and unfortunately failed, or it just didn't work the way that it was expected.
Okay.
But mainly, I would say that it's focused on implant dentistry and the prosthetics on one end, and also anything that has to do with the aesthetics component. So we have been able to combine and fine-tune all the aspects that people in a very challenging and demanding society expect.
Right. Now, you know, implants have become increasingly more popular
Mhm.
in our society. And I think that dentists like the fact also because it affords them additional revenue.
Mhm.
What should the average patient be careful about or beware of in seeking somebody who does? Because I see every sign out in the street.
About implants.
We do implants, we do implants, we do implants. And I'm sure that some people don't do them as well as others. Look at all the training that you've had in surgery and implants. And this is you're a terrific place to come to. But what should the consumer do?
Well, there's a few things that are very important. Number one, we cannot just by the fact of people saying, well, an implant is just like putting a screw in the wall. We're not carpenters. Okay, so the understanding of the biology and the discipline of how our body heals is what makes a carpenter different from us. Okay. Now, always the point that I make with the patients, there's no better implant than your natural tooth. We haven't done anything better than nature or than God yet. Having said that, there's one thing that is good about the implants. Interesting, you brought a point about increasing revenue. Once you place an implant on a patient and you restore that implant, and everything goes well, and provided that the patient stays healthy and maintains it, the odds of you having to replace that implant or that restoration are very slim, because we've seen implants in the mouth for over 30, 40 years already, and they keep going.
The patient is dead, but the implant.
Exactly.
Okay, I got it.
So, in all fairness, it's more of a treatment that you're aiming to have done once and properly. So, unfortunately, it's an expensive treatment, but the dividends that it pays are high, because any crown, no matter who does it, always between 10 to 15 years starts to have some little problems around. Even with the best and the best laboratory, the best technicians, and the best fittings that we can accomplish, you still can have problems. You know, it's called recurrent decay. That the decay starts to happen around the crown.
Right.
Okay. So I say that one of the best things that happened in dentistry in the last 30 years is implants. Today, it's very strange that we're going to file down natural teeth to replace missing teeth, which is a blessing. Okay, it made dentistry much more conservative. Obviously, with more dental education, people are losing less teeth, but we still have almost 40 or between 40 and 50 million Americans that are wearing dentures. So there's still a lot of room, and a lot of room for a discipline that keeps growing. Companies, dental implant companies, are growing at 18-20% a year, and that's the reason why.
Wow. So if a person theoretically has every tooth in their mouth removed and has an implant done, they will go to the grave with those wonderful implants. Is that right?
The answer is yes, but as I said, no better implant than your natural tooth.
Right, of course. Okay. Just wanted to know about your father, because I know he was the dean of the dental school,
Mm-hmm.
and what influence he played in your career decision.
Huge. My mentor, my friend, my everything. Unfortunately, one of the most difficult things that happened to me having emigrated was losing him while I was here. So the only thing and the most important thing that I wanted, in those days that the phone rang and I was studying and it was just pure stress because he was sick, the only thing that I wanted is to be there when I had to, and thanks God I was there when I had to. But a few days ago, it was already September 24th. It was already 6 years that he's gone, but he's around, and
Of course,
I'm sure he's very happy.
Very proud of you, I'm sure.
Proud, I'm sure he is, but he's very happy of how things are going.
Let me ask you a question about your sister, because you said she's a dentist as well. And, we take a lot of pride in this nation that women are coming up in the ranks and are being able to be professionals just the same as men. Was it a difficult thing, though, in Argentina to get to be a dentist?
No.
Is it unusual for a woman to be a dentist in Argentina?
The answer is no. Actually, there's more. In my class, there were more women than men. It's a very, very interesting profession for women because a lot of women work part-time and they can have a great profession and a great activity and a great living. Okay? Not necessarily having to spend 5 days a week in the office.
Right.
So it's from the standpoint of, for example, my sister was about to study medicine when she was, finding out, when she was after her high school. And she had a talk with my uncle, who's a cardiologist, and that talk made a difference in her life because he told her about all that about medicine and the rotations and the on-call services. So, and if she really loved the biologic aspect of the healthcare professions and treating people, I mean, she could consider dentistry, and that was something that she made that decision back then, and she never regretted it.
How does dentistry in the United States differ from dentistry in Argentina? And you can discuss this from the point of view of the education or the practice.
There's a lot of myths out there that dentistry or that everything, everywhere in the world is not as good. Okay, and I think that in every place there's room for great dentistry. I go to some meetings in Latin America, Brazil. I'm going down to Brazil in November with one of our colleagues here. The level of dentistry today is, once you find the right groups, is outstanding everywhere. So you're gonna find great dentists everywhere, and you're gonna find pretty bad dentists here too. So it's just a matter of really who wants to take it to the next level and to give the best to our patients and to really invest in education. And if we have to talk about the educational aspect, the only thing that I see is that here is very expensive, and it's becoming a limiting factor, and that's why I'm
Right.
really, it's not the best thing.
So how should a patient in New York City find the best person to do the best implant that they can? What questions should you ask?
I think that the bottom line is asking friends, asking family members, and finding out in the academia, in the schools, which are the people that are really teaching and leading the pack in terms of delivering the message of implant dentistry. It's very strange that you're going to find a chairman of a department, a director of a department that is not really among the people that are knowledgeable and that are not like just looking for money. They're just really into putting things together properly. And that's basically how this practice has been built from 30 years ago until these days. I mean, I joined this practice 7 years ago, but the core of this office has been education, research, academia. And that's all accolades to the person that started this practice, which is Guido Sarnachiaro. He's been chairman of the department. So it's very difficult to find that the right dental professional that is going to place your implants or your surgery or do your surgery you're gonna find him on TV. It's more like if I had to recommend people, it's just to really search and look for the prestigious and the most serious channels of communication in order to get that information.
And would you ask the question, how many implants have you done in the past year? Would that be an important question to ask?
Probably not that much many implants, but people feel comfortable with it. I hope you're not the first. This is not the first one they're doing.
Right.
But yeah, in all fairness, obviously experience is a factor.
Right.
And you want to make sure that you're not having the implant placed by somebody that's just starting or did a 2-day weekend course.
I think one of the many interesting things about your office that I've discovered is that you make your own, you have a laboratory and you make your own caps here.
Yes, we do,
and you do your own
in-house.
You do everything in-house,
Everything is
which
done
most
in-house.
dentists don't do.
Everything.
So this
That's
is
a very
unusual.
unique
Yes,
setting. That's
yes.
a very unique setting of having 10 dental technicians on staff here full time, working for a group of us, which are we are 7 dentists working here, not all full time, but it's basically a very unique setting, and that's really was incredible when I joined the practice to see that.
To do everything in-house, I think is most unusual. Well, I thank you very much for letting us come and see you. Yo puedo hablar español también, but I'll keep this interview in English, so for most people to understand. But thank you so much.
It's a pleasure, Paul. Thank you very much for coming.